Welcome everyone. My name is Emily Bacon and I am one of the group practice nurses here at the Pet Vet and the Vet. You may or may not be aware that the Royal College of Veterinary Surgeons have issued new guidance on the prescription of some medications. As this has a direct impact on our customers, we thought it would be helpful to provide you with an overview of the new guidance and allow you to ask any questions you may have. The new guidance forms part of the Veterinary Surgeons Code of Conduct as stipulated by our governing body. So we need to ensure we are fully compliant with the new guidance. So what is the new guidance? Effective from the 1st of September 2023, the guidance refers to the prescribing of veterinary prescription only medication known as POM-Vs. This is due to the importance of the ever increasing and worrying antibiotic resistance that we are facing. The potential negative impact from any parasitic medications, such as your flea and worm treatment, has also been a driving force for the new guidance. There are several key changes that hopefully I can explain to you during this webinar. Firstly, a physical examination is no longer required to take an animal into a veterinary surgeon's care, meaning you don't have to attend a consultation to register your pet with us. Veterinary surgeons must also provide 24/7 follow-up care. This can be provided by the surgery you are registered with or an out-of-hours provider. You should be given written contact details of the out-of-hours provider, so please ask your surgery if you need this. A physical examination will also be required before your pet can receive certain medication. So what medication does this relate to? If your pet needs antibiotics, antifungals, antiparasitic, antivirals, or any controlled medication, such as gabapentin or anti-seizure medication, the veterinary surgeon must first complete a physical examination of your pet. Medications such as antibiotics usually follow a consultation with diagnostic testing such as blood tests or urinalysis, so you may not notice a change in the prescribing of these medications. Antiparasitic medication, however, will be handled slightly differently following the implementation of the new guidance. This part of the guidance comes into place on the 12th of January 2024. So how will this impact our customers? To receive your pet's flea and worm treatment, you may be required to attend a consultation to receive a physical examination. If your pet changes weight and requires a different dose of medication, your pet may need to receive a physical examination before you can collect your pet's treatment. If your pet suffers an adverse reaction, such as a skin irritation to a topical treatment, you will be required to attend a consultation for your pet to be given a physical examination and prescribed an alternative medication. Nurses will no longer be able to offer weight clinics for the purpose of prescribing antiparasitic medication. And we will also not be able to accept updates of your pet's weight from our customers themselves. So what can we do to help? Clinical notes are currently being updated by our veterinary surgeons with clear written prescriptions of your pet's flea and worm medications to comply with the new guidance. All our customers will be eligible for a free of charge 5-minute flea and worm health check for a vet to be able to issue your pet's flea and worm prescription. Please be aware that only healthy pets are eligible for this. So if your pet is unwell, they'll need to have a full consultation with a veterinary surgeon. Hopefully that helps explain the changes you may experience due to the new guidance. But before we finish the seminar, has anyone got any questions they would like to ask?
Hi Emily, I've just got a question about my cat, if that's okay.
Yep.
So she's on long-term medication for hypothyroidism. Does this mean I need to attend a consultation with her every time I need to get her medication?
Yeah, absolutely. Great question. So no, the new guidance doesn't directly impact the prescribing of long-term medication. The veterinary surgeon will write in their clinical notes when a re-examination is due, as this will vary from patient to patient. The veterinary surgeon will therefore still be able to issue your cat's repeat prescription until this time.
Okay, lovely. And then for a flea and worm treatment, how come I can't see a nurse to update her weight?
So under the new guidance, the prescribing of POM-V medication, so that veterinary only prescribed medication, means that the medication has to be issued by a veterinary surgeon, and therefore you can't see a nurse to be issued that prescription. If your pet's weight does vary, then the medication dose will need to be altered, and therefore the new prescription will need to be given.
Okay, thank you.
I've got a question, if that's okay, Emily.
Absolutely.
Thank you. So basically, I took my dog in for his booster last month, but I completely forgot to pick up his flea and worm treatment. Does that mean that when I come back, I need to pay for a full consult to be able to get it?
Yeah, absolutely. Another great question. So no, the veterinary surgeon will have already written in his clinical notes the prescription that we can supply his flea and worm treatment against. So there's no need to attend another consultation. So this would have already been encompassed during your booster appointment.
Brilliant, thank you.
Any other questions at this point? Otherwise, I've got some FAQs that we regularly receive regarding the guidance. No problem. So one question from a customer. Will I need to attend a physical examination for my puppy to get their flea and worm treatment as they are still growing? So during the vaccination appointments, the veterinary surgeon can stipulate within their clinical notes the anticipated weights of your puppy. If your puppy matches these weights, we can issue their flea and worm treatment. However, if they don't match and are either under or overweight, then you will be required to attend a new physical examination. So I have another question. So my cat's weight has always been stable and never had a reaction to their medication. Will I need to attend a physical examination to collect their flea and worm treatment? So the new guidance allows for the veterinary surgeon to stipulate the length of supply for the flea and worm treatment, and this is usually 12 months. As you are likely to attend the surgery for her annual booster, it can be renewed during this appointment, so there'll be no need to attend another physical examination. Are there any other questions anyone would like to ask? Brilliant, no problem. So hopefully I have been able to provide a clear explanation of the changes that you may experience in the new year. But if you do have any other questions, please do contact your local surgery and our colleagues will be able to help you. So thank you ever so much for joining this webinar and take care.